I decided to pursue a PhD in social work because I wanted to really start to learn more about the root causes of structures of oppression and how our laws and policies and system cause the inequities that continue, even though we've been working on them for decades.
I have done clinical work for most of my career. When I went into social work, I always envisioned doing something on a more macro level. I'm really interested in research that can turn into advocacy and preventing people from having mental health issues in the first place.
A lot of the pieces of how the social aspects, relationships, community, access to food, identity impact people's health outcomes. And I was feeling like I wanted the opportunity to further my career in that space and also to train other social workers to think about the bigger picture of impacting people's lives on a social, political level.
It was an opportunity as a Black woman I didn't think I would ever get. And I say that specifically because I'm also a veteran, I'm also a queer student, but I'm a Black woman. And this was something I never thought or I've never seen in my family before. For my classmates to accept me in with my, invisible disabilities, I want to be able to pioneer more research to effectively help veterans who are in transition into college.
The kinds of problems that I'm looking to address with my research area has been really focusing in on how white people show up for racial justice and sometimes co-opt these movements in order to ease their own feelings of guilt around the existence of racism in our society. Some other problem areas that I'm seeking to address has been around how we can motivate folks to engage in collective action. And so looking at that gap between when we say that we want things to change and when we actually do things to create that change.
I'm really interested in sleep from a social justice perspective. And so part of that for me is looking at a pretty well-known, well-established sleep intervention and looking at access around that intervention.
I'm specifically looking at the ways that we can increase experiences of transgender joy for young people. So what are the ways as social workers, as family members, as community members, we can support young people so that they are having more joyful experiences, more positive experiences, and ultimately having better health outcomes, better mental health, versus a lot of the negative outcomes that we're hearing about or the negative sentiments or policy attacks on transgender youth.
I want us to evaluate the programming that we are providing to veterans. As a military person, as someone who works for the VA and someone who works in higher education, I know we do put money in the programs without close evaluation. And that's what I want to do with my research, is to be able to probe the VA, probe the federal government into military spending to see, and why are we just pouring money into programs that haven't shown to be successful?
The mentorship that I received throughout the social work program has been really great in the sense that I've connected with a lot of different folks, and I've had the opportunity to work as a graduate research assistant with multiple different professors.
I was really lucky to get to work with the Social Work Research Center, where I got to be a part of research studies and grant evaluations.
There were other folks in the department who were looking at equity issues, racial justice, what it means to be a white social worker in the field of research, anti-oppression. Those are all things that were really important to me when I was looking at different programs.
Yeah, so originally I came in and I had an idea. I knew what I was going to write about. It was like Black social workers, Black veterans in academia. And then I was like, okay, I can look broader. It's really pushed me to not narrow my research, to know that you can have a broad interest, and it may be time consuming, but if that's what you're passionate about, we're going to support you. The mentorship you get here, you feel like you're a partner. You're learning, but you feel like you're a part of it.
Coming into a PhD program after being out of school for so long, I was feeling sort of nervous, wondering who my fellow peers were going to be, what that was going to look like. Everyone is really supportive of each other. We text each other about assignments. We bounce ideas off of each other. We're also willing to be critical eye on papers, to challenge each other, to ask hard questions.
My cohort and my peers through writing groups, and we still have a text group, which is really important because we commiserate and we also celebrate each other.
And so coming into social work for me has been on my own journey of figuring out what it means to actually be part of a helping profession and how we can reckon with ourselves as a member in a collective society and moving from that individualistic lens to the communal lens. And for me, that's social work.
You know, understanding people, but also understanding the context with which they live.
We are looking at all of the social and societal pieces, what we can do as a field, as social workers, to impact those different systems in order to improve people's lives.
So it means that we get to work collectively, and it's not just a one discipline focus. So we get to broadly help individuals while also having, again, that macro, that meso collection, where we're affecting the world, not just what we're seeing in front of us.